Our next speaker is Dr. Yeliz Prior, who's a Senior Research Fellow here at Salford, and her talk is entitled Digital Tools for Self-Management of Arthritis.
Hi everybody, good morning. So I'm going to talk to you about as Los introduced me, about digital tools for self-management of arthritis this morning. If you're on Twitter, please feel free to tweet away, and here's my Twitter handle, and don't forget to follow Salford HMR as well. So prior to my training as an occupational therapist, I worked in IT for a decade, as I have been always interested in digital technologies. I completed my PhD at the Arthritis Research Centre UK, Keele University, to deliver an epidemiological study of self-care and joint pain in older adults using a large longitudinal data in people with osteoarthritis. Following this, I came back to Salford back in 2011 as a full-time researcher and undertook further training in CBT and mindfulness-based cognitive therapies focused on behavior change interventions. In addition to my full-time research post, I also took a part-time job in the NHS as a specialist occupational therapist to further develop my clinical skills in rheumatology. So my interest in behavior change interventions to enhance self-management led to exploring the role of digital technologies in this process. A growing number of health technologies such as wearables and apps are aimed towards this to prevent illness and promote health. The evidence on the role of health behaviors in increased risk for mortality and morbidity is compelling. So understanding the mechanisms which these various behaviors affect health outcomes is complicated by the broader social and ecological context in which they also occur. Of course, this complexity is further enhanced because behaviors don't happen in isolation, and interventions to achieve changes in behaviors have therefore been often limited in their effectiveness and especially long-term sustainability. Research on behavior change interventions highlights the importance of structural support and a range of requisites such as capability, motivation, and opportunities. These are practically easier to implement with use of digital technologies, providing these are accessible, relevant, understandable, and engaging. Nevertheless, the digital technology for health use comes with an even more complex set of challenges. So skills and abilities must align with the demands of and the complexity of the digital system to ensure the engagement and adherence with the systems. So digital technology brings many potential benefits for health, especially the prevention and treatment of non-communicable diseases, and rheumatic and musculoskeletal diseases are amongst the most prevalent groups of these diseases. However, as with many other health advances, those with the most need benefit least due to health and social inequalities. Thus, it's important to work towards closing the gap between skills and abilities and the demands and complexity of systems. So currently, there are various mobile health apps are available for people with inflammatory arthritis, particularly rheumatoid arthritis. I'm a scientific member of a European task force to set the standards for mobile phone apps for self-management in rheumatology, and I was involved in the development of the My Arthritis app, which you can see on the left-hand side, working with the Ampersand Health, which is a multi-award-winning social enterprise, and the charity National Rheumatoid Arthritis Society. So the ANRAs also have other apps such as the RheumaBuddy and Know Your DAS to help with self-management and remote access to patient data. But these aren't for all rheumatic musculoskeletal conditions. These are for rheumatoid arthritis only. So at Salford, we are at the forefront of rheumatology rehabilitation research. Over the years, we've developed a suite of patient-reported outcome measures, which we conveniently call as PROMs, and complex interventions for use in rheumatology therapy services. Some of these PROMs have been also translated to multiple other languages, such as Turkish, German, Czech, Iranian, and Swedish. So in order to increase access to these assessment tools and complex interventions, we have created the MSKHUB, which I'm going to talk to you more about now. So the MSKHUB is an online self-management platform to provide a free access to valid and reliable health information and assessment. And I emphasize the free here because that's not always the case with online digital technologies. So the purpose of the MSK Hub is to provide free access to valid and reliable health resource for people with RMDs through self-assessment using the evidence-based patient-reported outcome measures we have mainly developed at Salford, provide advice on self-help, assistive technologies and rehabilitation, and these are all tailored through the assessments they complete. And health professionals can also use it with their patients to aid their own assessment, goal setting for shared decision making and intervention planning. They will also have access to latest developments in the field in the rehabilitation of rheumatic and musculoskeletal conditions. So in terms of the MSK Hub website, this was co-designed with patient and public research involvement and engagement and a clinical advisory group of health professionals in rheumatology. It was an iterative process which constant testing, feedback, revisions and improvements were made to ensure the website was easy to navigate, information was understandable, and assessment templates were simple to complete on both various desktops or phones, such as iOS and Android tablets. So in terms of phase one, this involved the MSK Hub community development because it's very important to get the engagement to be able to use these systems, because systems are only as good as people are engaged and adhere with it. So we had 20 purposefully identified PPIE members from social media and clinical networks, and they were brought in as collaborators to form the MSK Hub Patient and Public Research Advisory Group. We also had a separate multidisciplinary group of health professionals identified through academic and clinical networks to form the MSK Hub Health Professionals Reference Group. So this is how the website looks like on the front and login page. In order to use the full function, one needs to register and consent to sharing data. We know that personal data matters. Therefore, we have an easy to read and transparent GDPR policy to explain how personal data is collected, used, shared and disposed to meet data protection requirements, which is available to users prior to registration to help with the informed consent. So once the user is registered, they can then have a complete series of patient-reported outcome measures to complete. The screen you are looking at shows the separate domains of the daily activities, such as eating and moving around and indoors. There are actually 14 domains in total, which is hard to get into this screen. And on completion of these assessments, they are provided with meaningful scores and brief self-management advice. So they are signposted to other sources that they can help themselves. They're able to download the completed assessment in PDF form to share with their health professionals when they're going for their clinical appointments to save time on clinical assessments also. So MSK Hub users also have access to the MSK Hub social networks through this platform, and we have a Facebook group, which is a closed private group for discussing sensitive issues, and therefore it needs admin, which is myself. I have to do kind of everything in MSK Hub, approval to join in. And MSK Hub Twitter account is more open and is about the promotion of the website and bridging the gap between patients and the clinical and research academic community. So in terms of the phase one, we purposefully sampled 25 participants. So these were the participants not involved in the development process, so they're not our PPI members, to use the website on their own devices at home for a month. And then they developed the feedback for completing a user experience survey to assess the ease of use, helpfulness, and satisfaction with the MSK Hub. We also conducted qualitative one-to-one virtual interviews with these participants to get more rich data about their experience and their feedback of using the MSK Hub. So in terms of findings, participants completed the registration process around 1.5 hours, which was expected because there's lots of assessments and they can do this over a few weeks. And all of the assessments were deemed as relevant and important, and they reported high levels of usefulness and satisfaction, as well as indicated that they would continue using the MSK Hub and recommend it to their family and friends with rheumatic and musculoskeletal conditions, because anybody can sign up to MSK Hub. So here's some sort of comments from the qualitative interviews. One of the patients said, "Now I know what clinicians look for when I try to explain how I'm struggling to get from one day to another." So to summarize, the phase 1 involved the creation and testing of the usability and acceptability of the MSK Hub. And we have demonstrated that the people in the UK with rheumatic conditions shown a high degree of acceptance of the MSK Hub and could use it easily. This is an important step in developing evidence-based, appropriate and user-friendly online health platforms, because most platforms are there not necessarily using scientific evidence-based approach. And the next step is the phase 2, which is the wider testing for general site activity, use and evaluation through a variety of embedded appraisal methods within the site, which is underway. So what happened quickly during the COVID is that our OT departments at Mid Cheshire was mostly redeployed, and we had to adopt a new way of working, and MSK Hub come very handy for using remote monitoring and measurement and doing self-assessments. But also, we previously delivered an occupational therapy group education program for people with fibromyalgia, which was very popular. We had hundreds of people waiting lists. So, of course, we couldn't do group program following the COVID, so I was able to lift the group program to online delivery and continue with this delivering online, which was really helpful as well. So in terms of next steps and opportunities, currently considering alternative funding streams to be able to continue to develop MSK Hub as a large longitudinal quantitative data repository for people with RMDs and expand our range of assessments. And we are also planning to embed a qualitative data repository to capture lived experience of people too. So I'd like to acknowledge the MSK Hub Phase 1 funders, the Logrest Trust, Council of Allied Health Professions Research and University of Salford, and would like to thank my colleagues listed here for their support. And lastly, but most importantly, I'd like to acknowledge the Salford Patient and Public Research Advisory Group for their unstinted work and enthusiasm, as well as the members of the Health Professional Advisory Group for volunteering their limited time to contribute to this project. Here is some work arising from this development. And thank you for listening.
Thank you, Yeliz. That was very interesting. We've got a question from one of the audience members. What's the uptake in terms of unique new patients per week on using the proms on the MSK Hub? Do you have any idea of figures?
Yes, so at the moment I do everything on MSK Hub maintenance, so I'm getting emails every time somebody signed up. So usually prior to COVID, we were getting at around 30 to 40 people a week. And during the COVID, this has increased, partially because 17 different NHS trusts in the UK started to use the MSK Hub for remote assessments. And so that's coming to more about the hundreds now a week. The issue is not people are signing up, is about keeping people in there. And of course, there are issues with funding, which is quite difficult to get. So because I am the only person who is doing everything in this project and my time is quite limited. So we need to, and there are a lot of issues with websites you need to be quite reactive. So we really need more funding to be able to sort of keep that people coming and staying at the moment.
Okay, thanks. I've got one question. So I think with all health interventions, one of the, particularly I guess in the area of self-management, one of the problems, and I think this this issue is coming out in things like screening for COVID is how to reach the hard to reach group, the group that don't engage very well. I guess that's not only true of digital health, but of health in general. But I guess with digital health, you've also got the digital literacy problem on top of all the other issues. How are you addressing that aspect?
So absolutely, and I'm quite passionate about this. And I work with Neil, our keynote speaker, and Chris Nesta, for example, in diabetes to reach this hard to reach populations. And through my role at the British Society of Rheumatology, I'm the vice president in this charity, and I have links with charities with working for these people with hard to reach populations, people from minority ethnic backgrounds, people who don't necessarily speak English, so South Asian populations that came to here. So yes, there are many challenges, and I would like to, so the prompts that we are using MSKHUB, as I said, is translated to different languages. So one of the things that I would like to do is be able to actually deliver the website in different languages, at least in the UK, to reach those populations. But then there are other challenges such as the socioeconomics and people's access to digital technology to be able to actually even get mobile phones or data bundles to access to internet. So the challenges are huge, and we're doing our best and tackling one problem at a time at the moment. But yes, as you say, the digital health is not perfect, it's not always accessible, but nor the face-to-face health sometimes. So I think we're going to have to keep plowing on, trying to tackle these challenges.
Okay, thank you very much.